heard you also speaking about sleep, how important sleep is. And I talked with a friend of mine who's a psychiatrist, and she told me, you know, sleep is so important. We always say 8 hours is the minimum because otherwise it's getting into a risk that they are developing mania. And I think
I don't know about 8, but maybe 6 to 8. I mean, there's a lot of individual variation, but you certainly want regular, adequate amount of sleep. But again, if you're telling, you know, we treat a lot of university students and college students, right, and doctors. If you tell them that they need to get regular sleep, again, it's important to do it, and it's important as a doctor to persuade on the basis of science. But it's not necessarily going to work. I mean, a lot of people don't like sleeping a lot, and so you can come in and say sleep, and that's great, but people aren't necessarily going to do it. But it's very important to continue reinforcing it.
Yeah, because I was just thinking, when we have these people also having these impulse control disorders, they are often not aware, perhaps also ashamed to talk about these topics because they're also shame-related, like hypersexuality. Who talks to a doctor in the first consultation? Ah, yeah, you know, I'm having every day my sexual desires done and I'm not relieved and I need more. So this is something which is very difficult then to trace it, and we want to trace it before it comes to this disastrous, like you say, in mania. I mean, when everything already is lost and they have damaged so much in their social environment, we don't want to go them there. So we need somehow to prevent it to go there. But the difficulty is when the patient doesn't say it, we can't basically lower the medication.
No, but I think one of the things you try and teach young doctors is you ask and you ask and you ask again, and you keep asking. You don't assume that the answer on Tuesday is going to be the same as the answer on Thursday. You don't assume that somebody might not be a little bit more depressed, and when they're a little bit more depressed, they're going to be a little bit more self-aware of the consequences. So you, I think, want to be able to say, look, I may be annoying by asking you these questions about suicide, about sex, about various and sundry things that make you uncomfortable, but I'm going to keep doing it, and it's really important, and tell me when it's upsetting to you. So you want to have a relationship with a patient that allows you to make it easier to be honest. And that takes a while, and that's the great beauty of good psychotherapy. There's a lot of bad psychotherapy, but that's the beauty of really good psychotherapy.
Yeah, because we realized also sleep is a good door to basically get to this point, making people talk about these issues, because who wants to talk about sex? Who wants to talk about gambling or something? Yeah, some of them want, but I think there are really a lot of people who say, yeah, my sexual life is okay. And then you know, okay, they don't.
But again, I think that's the job. I mean, it's like young doctors often say, well, what can I do to try and convince somebody to take medications they don't want to take, that have side effects, that interfere with the denial that I have an illness and so forth? That's your job, you know. Yeah. It's the job of the doctor. It's not the job of the patient. It's the job of the patient doctor to keep at it and continue to ask patients, what is it that would make it easier for you to talk to me about this? It's really important. These things are really uncomfortable, but what can I do to make it easier? Do you want to write about it? Do you want to, you know, tell me down the pike? I mean, I think creativity in a doctor-patient relationship is enormously important, instead of just asking questions that people feel, quote, uncomfortable to answer.